Back with another session here. Here we'll start with the ward rounds. I'll first here in this video discuss what is ward round, what topics need to be covered for ward round. This is a very important part of NBE practical exam pattern. So starting with this, what is ward rounds? So in the DNB practical examination, ward round is very crucial. Like it is of total 40 marks. You will get 4 cases and the 10 marks allotted for each case. So total 40 marks. During the ward rounds, you will be presented with a real patient admitted in the hospital, and a second and third year resident from the same hospital will present the case to you in front of the examiner, and the resident will provide a brief history and current status of the patient, including the complaints, the diagnosis, treatment given, the post-op day if applicable, vitals, lab results, and a recovery progress. For example, they may say this is a 28-year-old G2P1 post-LSCS day 3, vital stable, afebrile, mobilizing well, passing urine and stools normally with an HB of this and so. Your role is to ask the right clinical question. So your role is to ask the right clinical question based on the case presented about the patient diagnosis, operative finding, post-op care, and complications. Investigations, medications, follow-up plan. This step tests your ability to pick up the critical details and identifying the gaps and think clinically. This is what is judged at that time. So after your question, the examiner will evaluate your approach by asking you follow-up question based on what you missed and did not cover adequately. They may also ask about the rationale behind the investigation, management decisions, and the guidelines related to that case. So why it is important? Because it is like giving you a high scoring opportunity. It is one of the easiest section to score because it focus on your practical knowledge and real time clinical judgment. Real world skill assessment. It evaluates your ability to manage patient in an hospital setting, which is essential for being a competent clinician. Marks distribution, as I told you already, 4 cases you will get each of 10 marks, total of 40 marks. How to ace the ward rounds? First of all, listen carefully. Take note of every detail the resident provides, vitals, investigations, and the post-op status, and the medications. Then structure your question in your mind, like group your question into categories like intraoperative, post-op details, blood loss, complications, histopathology, current status, vitals, wound condition, bladder and bowel function, medication, antibiotics, analgesics, and anticoagulants, follow-up plan, discharge advice, further investigations if needed, and counseling. All you have to like structure in your mind, and you have to ask if you find it reliable and relatable to the question. Think practically, ask questions that reflect your understanding of patient care, not just the textbook knowledge. Be confident and systematic. Stay calm, take a moment to organize your thoughts and present your question and answer clearly. This approach not only helps you score well but also build your confidence in the real world patient. Now let's know the revise the common ward round cases which are coming in the exam. So for obstetrics, it is preeclampsia, GDM, IUGR, PPROM, APH, PPH management. For gynae cases, it should be fibroid, endometriosis, AUB, pelvic infection, adnexal masses. Mostly the cases will be these. Post-op cases, which are usually you will get in the ward rounds, are post-LSCS, post-hysterectomy, checking for vitals, wound status, and DVT prophylaxis, fluid balance. Stay tuned for more. In the further videos, I will explain you how to take ward rounds. Thank you.